Hi guys, my name is Weston. We are going to be talking about pertussis and the bacterium that causes that. The bacteria that causes that, you can see just right behind me right here, is called Bordetella pertussis. Here I have a electron microscope slide or picture, I guess, of Bordetella pertussis. You can see from this that it's a dipole bacillus bacteria, and it appears blue here. That's not really of consequence, though. I'm going to talk a little about the etiology of it. The first thing that we should notice in this diagram right here is that there are fimbriae. That is something that is important with pertussis. Something else that's important to recognize is that pertussis uses toxins. The only toxin that I'm going to touch on is the pertussis toxin. However, the other toxins do have a big part in pertussis. As I said before, it is a dipole bacillus bacteria. Something else that we should know about the etiology is that it is a gram-negative bacteria. So there is a cell wall, but the cell wall is not the outermost structure. And because of that, we have the fimbriae and the ways that the pertussis can attach to nearby cells. It is non-motile. You'll see in the diagram that there isn't any flagella, which is what we would need for it to be motile. So the question is raised, how does it get around? Well, I'll touch on that in just a second. As I said, it uses fimbriae to attach to cells, specifically to ciliated cells. And again, that's on the next slide. That I'll talk a little bit more about that, and it does use the toxins for survival to kind of create the optimal environment for itself. Humans are the reservoir for pertussis, and as such, pertussis is specific to humans. So Bordetella pertussis is not going to cause infection and the whooping cough disease that it would cause in humans if it's found in other animals. It can be found in other animals, but it probably won't enter a pathogenic state. Now, just talking a little bit about the ciliated cells and then also about the pertussis toxin here. Here you can see this little diagram. I really liked this. On the left part over here, you can see ciliated cells usually will have some kind of a movement to them. Remember, pertussis or whooping cough is going to be infecting the respiratory tract. And in our respiratory tract, those epithelial cells are ciliated. There's lots of mucus in there, and the cilia help to move debris and all sorts of things through there so we don't get any sort of inflammation or anything like that. So pertussis, what will happen, it will come in here and attach to these cilia of the epithelia cells, and essentially will stop the movement with itself, with the pertussis toxin, and that will spread about. And with the lack of movement with the cilia, that's going to cause some inflammation, some swelling, a lot of irritability, and so that's where the coughing and the respiratory distress comes from with pertussis. Here is a diagram of the pertussis toxin. It's important to note that there are 5 different subunits of this, and through the subunits, one is classified as the active subunit. The others are just there for attachment and structure.
Hello, my name is Justin Orchard, and I am going to explain the treatment and the transmission of pertussis.
Pertussis is transmitted from person to person. Only humans can get it, so you don't have to worry about giving it to your pets like a dog or cat, or getting it from your pets. You can only get it from another person. You can get pertussis from contact with fluids from the infected person. So that means that if maybe somebody sneezes on their hand, you shake their hand and then touch your mouth or your eyes with that same hand, you could definitely get pertussis. Another way that you can contract pertussis is just by breathing the air of an infected person. So if you're in close proximity with somebody that's breathing it, that bacteria can actually spread into your respiratory system from theirs. Pertussis is highly contagious, so you have to be very careful if you are infected with it, who you associate with and how close you are to them.
Hi, I'm Paulina, and I'm going to talk about signs and symptoms of pertussis. Symptoms of pertussis usually develop within 5 to 10 days after being exposed, but sometimes not until 3 weeks. Early stage first 1 to 2 weeks with common cold symptoms like runny nose, moderate fever, occasional cough. For babies less than a year, which is harder to observe, which I will show you in the next slide, to look for a pause in coughing pattern. Pertussis is most dangerous for babies. About half of babies younger than 1 year who get the disease need care in the hospital. Later stage, paroxysm, or we call fits, of several rapid coughs, followed with a high-pitched woof sound, vomiting during or after fits, exhaustion after coughing fits. Coughs may occur more at night. Pertussis can cause severe coughs over and over again until the air is gone from the lungs, and you are forced to inhale with a loud whooping sound. The coughing fits may last for 10 weeks or more. In China, pertussis is known as the 100-day cough. The whoop sound is often not there for those who have less serious disease. The infection is normally less serious in teens and adults, especially those who have been vaccinated. This is a sample of a whoop sound that I mentioned earlier. I can't get the sound to work, but I would like to show you how there's a pause in the middle of coughing pattern. Disease progression, stage 1, catarrh stage with cold-like symptoms, but very highly contagious, may last 1 to 2 weeks. Stage 2, paroxysmal stage, lasts from 1 to 6 weeks, but may extend to 10 weeks. The symptom is more severe with numerous rapid coughs followed with a whoop sound. Vomiting and exhaustion involved also. Stage 3, convalescent stage, may cough less and last for about 2 to 3 weeks, and the recovery is gradual.
Good hygiene can help prevent pertussis. Washing your hands, obviously, like the scenario I talked about earlier, can help you from getting that bacteria from another person. So keeping yourself clean and taking hand sanitizer, washing after you touch doorknobs and things like that can help prevent pertussis. Antibiotics can decrease the amount of time a person is contagious. They say that normally a person is the most contagious within 2 weeks after the onset of symptoms, but if the antibiotic is administered, it can help decrease that time. It is the most effective if it's administered early on, so the sooner you get it, the better. Luckily, there is a vaccine for pertussis, and it can be administered to anyone from babies to older adults. And there's 2 different kinds, the DTaP, and that's used for children younger than 7, or the Tdap for people who are older than 7. So the letters stand for tetanus, diphtheria, accelerated pertussis. So the vaccine is actually for 3 different bacterial infections. And the capital letters on DTaP indicate full doses, so that's why it's given to younger children. The Tdap vaccine is given for older people, and the pertussis vaccine is called a toxoid vaccine. And that means that the vaccine uses chemically denatured bacterial exotoxin, which is harmless to the body but allows for antitoxin production. The antitoxins are able to neutralize the natural toxin if it is ever encountered in the future. Adults should receive regular boosters if they've had the vaccine previously because they still can get infected. The vaccination isn't 100% effective, but it is definitely helpful.